I'm joined by Dr. Cathy Beaver. She's the Medical Director and Vice President here in Enhance Health, and she's going to tell us what brought her to this facility and the unique services they offer that can give us a new lease on life. Thank you for joining us.
Happy to be here.
Now, Enhance Health has a unique philosophy, and you come from a very traditional medical background. Tell us what brought you here.
Well, I had been a primary care doctor for many years, and most recently focused on obesity medicine. And what I realized is that with so many patients, we are focusing on the disease and treating the disease and preventing disease, and maybe a little too late. So much of chronic disease, 80% of chronic disease, is directly linked with lifestyle. And I really realized that although at some point everyone may have some medical condition that impacts their life, up until that point it would be really great if everyone could live the healthiest life that they could. And by focusing on lifestyle and really focusing on the behaviors that drive the choices people make, we may be able to impact people to make them as healthy as they can, help them become as healthy as they can be.
And here at Enhance Health, there really is an integrated approach where psychology really is the key and the linchpin that sort of connects everything else. And you do some really unique cutting-edge assessments here that help put all those pieces together. Tell us about some of the medical services you offer.
So we are a primary care practice for adult patients, and we really do continuity of care for any adult patients that are interested in establishing that care. But we really look a little bit beyond, again, the traditional model. So our focus is to delve into lifestyle, really look at nutrition, really look at gut health. We have bacteria that lives in our gut that really impacts how our own health, and so how that relationship between the bacteria in our gut and ourselves is related. We focus on cardiopulmonary fitness. We focus on physical activity, and then really look at the guidelines, the evidence-based guidelines for preventative medicine.
And even when you take that, we really acknowledge that there are things that we do in our life that may exacerbate a condition or our genetics that we don't even realize. And you use the psychological portion of your evaluations and collaborative approach to help fill in the missing pieces.
That's right. Again, when we think about the fact that 80% of chronic disease, things like heart disease, cancer, diabetes, all of these medical conditions that affect so many people in the United States, obesity in particular, obesity, a third of people in the United States meet the criteria for obesity, and another third meet the criteria for being overweight. So when we look at all these different conditions, they're all directly linked to lifestyle. And what are we talking about with lifestyle? We're talking about what we eat, what kind of physical activity we do, how much sleep we get, whether or not we smoke, stress management, all of these components of lifestyle that are driven by our behaviors. And what drives our behaviors? I think that's the big issue. And that's our thoughts. That's where the psychology piece comes into play. Why do we make the choices we make? Oftentimes we know what's healthiest for us, but really what are the barriers? What's preventing each individual patient from achieving their goals and becoming as healthy as they can be?
And in that case, then the psychological therapy and counseling becomes an integral part of addressing whatever that condition is that's existing or even preventing one from appearing, right?
That's right. So we do two things. We do psychological fitness and also identify perhaps some underlying psychological conditions that patients may not know or be aware of that they have. And sometimes these are what drive the behaviors. So we can certainly address and identify patients with underlying anxiety or panic disorder or other psychological conditions, as well as looking at, like I said, the psychological fitness, which is really looking at skills like resilience,
right.
And how patients can address and face different situations in their life.
And I think that's why it's so important for your practice to have the collaborative approach. And one of the things you do is a proprietary record sharing just within this office. So that way everyone on your team, whether it's a psychological side or medical side or your fitness side, is all working together.
That's right. So on the psychological side, we offer therapies, cognitive behavioral therapy, we do family therapy, we have all different types of interventions and treatments that are then coordinated with the medical treatment as well. So if patients really want to utilize all of the services, they have the ability to have their physician or their medical practitioner be in direct communication with their psychological practitioner.
No wonder you came here.
Right, it's great.
We want to thank you for joining us today. And if what you're hearing strikes true with you, that you're interested in an integrated approach where you are an active member in your healthcare, remember to come down and talk to Dr. Beaver and all the people here at Enhance Health.